Just going. I'm going to have to hold this. Can I get this to you? Is your tie and jacket situation? I'm going to do this just for the show. I'm sucking. Yeah. Are my ties all right? Yeah, you're good. Good morning. My name is Terry Foster. I am the 2023 President of the Emergency Nurses Association. I'd like to thank everyone who has made time to be here today for this event that will highlight two key issues impacting emergency nurses, emergency departments, and ultimately the delivery of patient care. To start, let me tell you about today's speakers. Just as emergency nurses and physicians are a team in the emergency department, the ENA and the American College of Emergency Physicians regularly collaborate on topics of key importance to our respective members. Thank you to ACEP's Congressional Affairs Director Ryan McBride and Dr. James P. Phillips for being here today, and to ACEP for standing with emergency nurses, our ENA members, on these important issues in the emergency department. From ENA, I am joined by immediate past President Jennifer Schmitz, Chief Government Relations Officer Richard Moreau, and member advocates Heidi Gilbert, Dan Nadworny, and Christian Stone. Today's speakers truly share a deep understanding of the challenges faced by emergency departments. The ever-present threat of violence against healthcare workers compromises the ability of emergency nurses and the entire emergency team to deliver the highest quality care to each patient. Violence has left us with physical and psychological scars as emergency nurses, and it is forcing many to leave their jobs. There is also a mental health crisis in this country that is easily observed in the emergency department on a daily basis. People in need of mental health care frequently turn to the emergency department, but a lack of resources for providing the proper treatment that they need or the ability to get these patients to the right place for care often results in them sitting in an emergency department for an unacceptably long period of time. That in turn contributes to overcrowding, longer wait times, and additional stress on the emergency nurses and every member of the emergency team. I can tell you, I have been an emergency nurse for over 45 years, and I still see this firsthand. And I can also tell you that in the past 3 or 4 years, it has gotten exceedingly worse. In these 4 decades as an emergency nurse in Kentucky, I've experienced firsthand also the rise in violence against healthcare workers. I have seen the number of patients struggling with a mental health crisis increase tremendously, and I've done my best to care for them without any consistent growth in the resources available to provide the right treatment options at the right time. Emergency departments, we are the front door of the hospital. It is the healthcare safety net in many communities. They have no place else to go. Every patient who arrives in the emergency department deserves the absolute best from nurses, physicians, and other healthcare providers. But that isn't possible the longer that workplace violence is considered a part of the job, or if an urgent emphasis isn't placed on improving access to mental health care, resources, and care in and beyond the emergency department. Today's speakers will share their recent experiences and perspectives gained throughout their careers. These stories set the tone for why positive change and impactful solutions are really an absolute must now. You'll also hear about the important legislation now in the hands of Congress that has the ability to turn the tide on violence by implementing key measures to reduce the frequency and the severity of workplace violence, as well as legislation designed to create more resources and a more collaborative approach to caring for patients experiencing an acute mental health episode. I want to personally thank Senator Tammy Baldwin and Representative Joe Courtney for their work on the Workplace Violence Prevention for Healthcare and Social Services Workers Act, and Senator Shelley Moore Capito for her development of the Mental Health Access from the Emergency Department Act. ENA is very honored to have you on the side of emergency nurses and all healthcare workers who will benefit from the passage of these important bills. You have validated our work as healthcare providers and, more importantly, our value as people dedicated to helping others. You recognize we deserve to do our jobs without fear of being attacked. You understand we need greater resources to support patients in a mental health crisis. The Emergency Nurses Association, its 50,000 members, and its partners are committed to supporting these bills every step of the way, knowing passage into law means safer emergency department environments, increased resources, and overall improvement in the care of our patients. I'd now like to invite Christian Stone, an emergency nurse from Washington, D.C., to the podium. Christian?
Good morning, everybody. My name is Christian Stone. I want to thank ENA for inviting me to share my story with you all this morning. I am an RN and assistant nurse manager at a small community hospital here in the D.C. area. I have a background of 7 years of EMS experience before I became a nurse, which I thought would prepare me pretty well for being an ER nurse, but honestly, nothing prepared me to walk into a shift every day just to get screamed at and spit on and swung at, cursed out, kicked, threatened by patients and their family members, just while trying to do my job. And that reality set in pretty quick for me. The story I'm sharing today started one night last year when security alerted me that a patient was overdosing in the parking lot. Somebody had just dropped him off. Brought them inside, got them stabilized. About 2 hours had gone by. And I noticed the patient was out of bed, kind of wandering around the unit. I redirected him back to his room. And mistakenly, I got myself backed into a corner. And, you know, you're kind of taught from the beginning, don't ever get backed into a corner in a patient's room. But this patient wasn't violent. They weren't aggressive. So I really didn't think anything of it. And by the time I realized what I had done, it was almost too late. Suddenly, I found myself shoved into that corner, and I was getting a bite taken out of my shoulder. Luckily, another nurse saw what was going on, and she came in and helped. She pulled the patient off of me, but just far enough for him to reach his hands around my neck and squeeze as tight as he could. And I remember thinking, this is not the way that I want to die. But luckily, help came. They were able to pull him off of me, and I was able to get some first aid. The police were called, and, they came and wrote their report, and the patient wasn't arrested. They apparently almost never are. I was told, when you get off in the morning, go to the courthouse to file charges, which I did. But I remember talking with it about other nurses on the unit, and everyone's attitude was, don't waste your time pressing charges. Nothing's going to change. Nothing's going to get done. It's a waste of time. That really bothered me. That shouldn't be the norm for when this happens. It's no wonder that nurses are fleeing the bedside if the morale and the self-value is so low that nurses are just saying, why bother? And I don't blame them for wanting to leave the bedside either. Even that night, when I got home, I was searching for jobs at, urgent cares, maybe changing to the clinic. It's definitely something I considered. Maybe the grass is greener on the other side. But I love the teamwork that we have in the ED. And the thing about violence is it's in the ED, it's a vicious cycle. So if you leave the bedside, then the already short-staffed coworkers are even more short-staffed, and that leads to longer waits, and people get more angry and more frustrated. Then it's only a matter of time until the next nurse is assaulted. So, and that coworker might not be as lucky as I was. With that in mind, I went to the courthouse the next morning and I pressed charges. And I went back in for my shift that night, bruised and sore. But to try to be a leader for this movement of ending workplace violence in the hospital, a leader in normalizing reporting and seeking justice, to show my fellow ED nurses and doctors and techs that workplace violence, no matter how big or small, is not okay. We have to speak up against tolerating it. We have to talk about it, and we have to stand up for each other before it's too late. Thank you for your support for emergency nurses.
Hey there. Thank you, Christian, for speaking on that. My name's Heidi Gilbert, and I am an emergency department clinical educator in Stillwater, Oklahoma. I have been a nurse for 25 years, and I have experienced violence personally. I've seen my coworkers attacked. I've worked in overcrowded emergency departments where we've had patients boarded for up to a week with very limited resources. I have never in my 25 years seen the staffing crisis that we're experiencing right now, and frankly, I'm scared for our healthcare system. In 1 year, our department lost 7 nurses, 4 of them new grads with 1 to 4 years of experience that were already burnt out in their first 4 years and have gone to home case management positions away from the bedside because nurses are tired of being abused physically and verbally at bedside, and so we're seeing burnout in our first 4 years of our new grads. 100,000 nurses left the workforce during the pandemic, and according to the NCSBN, they anticipate 900,000 more leaving the bedside by 2027. So that's a fifth of our workforce will be gone from nursing if we don't have real change. What's going on with nursing is that during the pandemic, we have increasingly been asked to do more with increasingly less resources, less budget, less staff, and we've been proud and happy to do that. What we've not been proud and happy to do is to do those tasks while being abused. Nurses don't deserve that. We were once revered and respected and protected, and now we're increasingly abused. We're healers, we're advocates. Some have called us heroes. What we are not are martyrs or masochists. Nurses have had enough and are saying no more. It's not worth it. I am very fortunate to work for an organization that does it right, who treats nurses with respect and supports nurses and has a zero tolerance for verbal or physical abuse. Too many nurses are not as fortunate as I am, and it's unacceptable for any of us to be in unsafe environments. We need to be protected. We need impactful legislation and real support from our organizations. A safe environment to care for our patients is the bare minimum expectation that we should expect. We're bleeding nurses, and soon there will be nobody to care for the most vulnerable populations. So, thank you.
Good morning. My name is Dan Nadworny, and I've been an emergency room nurse for about 20 years now. Currently, I serve as the president of the Massachusetts Emergency Nursing Association and work as a nursing director just south of Boston. Over my career, we have fought the stigma of mental health, moving it away from hidden shadows and asking our patients to come forward and be vulnerable, to be honest with their healthcare providers. What I am seeing now is that when those patients come forward, are honest and vulnerable, they are lost. They are lost to a fractured system that lacks open access or community support for them. In our emergency rooms, we are seeing the result of this fractured system. We see patients in crisis. We also see patients out of frustration, the frustration of having no other option but to seek care in our emergency departments. What's very unfortunate is that when they come to our emergency departments, they sit. And they sit for days, weeks, and yes, even months, waiting for the next step of care. In my home state of Massachusetts, each day between 500 and 700 patients wait in our emergency rooms for the next step in their care. They sit not because of a lack of effort, but because of a lack of opportunity. There's a lack of providers, a lack of behavioral health hospitals, a lack of technology, and a lack of an investment in mental health in the same fashion that we have for other diseases. It is challenging for us as emergency nurses to come in each day and seeing the same patient sitting, waiting, sometimes in a hallway for days on end. As you've heard from our past speakers, emergency departments are not a calm and therapeutic environment. They are often a site of chaos and violence. This is not a place where we want patients with vulnerable states to be getting therapeutic care. We want them to be in the next place, the place where they can get the care that they need and not just be housed and kept safe. This is especially true for our pediatric population, who have even less resources than many. And to have small children in the ages of 6 to 12 years old sitting in a hallway in an emergency room watching violence is not the best thing for anyone and nothing that we should ever accept. There is a need today for us to continue to move forward with the care of behavioral health patients. We have a responsibility to those that have asked for the past 10 years to come forward, not when they're in crisis, but long before that point, and God willing, before they ever have to have the issue of taking their life. This legislation, improving mental health access to the emergency department, is a step in that direction. There is need for legislation to gain support by grant funding and initiatives to increase telehealth and especially community-based access points. In my home state of Massachusetts, this year we've launched a program to have community behavioral health centers. While we don't know the full outcome of this, it is an opportunity through grant funding to support brick and mortar structures in our communities to give the proper triage of patients. The mantra, "An ounce of prevention is worth a pound of cure," holds so true for these patients. It's our responsibility to advocate for these patients while always being available for them in their moments of need. Thank you.
Good morning. Thank you to the Emergency Nurses Association for the opportunity to speak here today and for the continued partnership of our organizations on the issues facing the dedicated physicians and emergency nurses who provide the healthcare safety net. My name is Ryan McBride. I'm the Congressional Affairs Director for the American College of Emergency Physicians and our 40,000 members. Like ENA, ACEP went to Capitol Hill this week to bring attention to some of the most pressing issues facing emergency physicians today, including the ED boarding crisis and the growing problem of workplace violence. Unfortunately, these issues are too often invisible to the public, but they're also more related than policymakers and the public might think. Right now, emergency departments have been pushed to or even past the breaking point, and patients are boarding even after they've been stabilized and treated because there's simply no place for them to go to receive the important follow-up care they need and deserve. Sometimes patients are stuck waiting for days, weeks, even months in some cases, waiting for the care that they need. Meanwhile, emergency physicians and nurses have experienced rapidly escalating rates of threats and assaults in the workplace. This contributes to the growing dissatisfaction and burnout, leading to more of these dedicated professionals to leave the healthcare workforce, further exacerbating this boarding spiral. We can't accept these conditions as just part of the job. We wouldn't accept this in any other workplace, and we can't accept it in the healthcare setting. And that's why we and ENA hit the Hill this week. So it's my honor to introduce Dr. James Phillips, MD, FACEP, who will provide the critical firsthand experience and perspective of an emergency physician on the front lines and share how these issues affect the health and well-being of emergency physicians and the patients alike. Dr. Phillips is an associate professor of emergency medicine and chief of disaster medicine at the George Washington University School of Medicine here in Washington, D.C. and he's a fellow of the American College of Emergency Physicians, and he also serves as the chair of the ACEP Disaster Medicine section. He's a recognized expert in healthcare workplace violence and has published seminal work on the topic in the New England Journal of Medicine. And today is also his birthday, so thank you for spending it here with us today, Dr. Phillips. Happy birthday.
Good morning, everyone. Can everybody hear me? All right, I'll try to project. It's an honor to be here today with the Emergency Nurses Association, representing 35,000 emergency physicians who are part of the American College of Emergency Physicians. That's my daughter. As you know, healthcare workers are more likely to be victims of workplace violence than in any other profession. We work in the most violent, non-law enforcement industry in America. This violence can take many forms, including verbal abuse, physical assault, sexual assault, online harassment, stalking, and even murder. I'm an emergency physician, and I have been a victim of both verbal assault and physical battery multiple times. I've been called unspeakable names, threatened with harm, branded a racist, manipulated by real-time threats of frivolous malpractice lawsuits, and threatened with false reporting to medical licensing boards. I've been chased through the ER and forced to hide behind a door, and I've had someone spit in my face. Each of these incidents has been perpetrated by a different patient, and all of them have happened just this year. In the past, I've pressed charges against a patient who hit me in the face with a phone. 4 years ago, I did the same against a patient who planned to return to the emergency department and shoot me and the nurse, and we weren't even the people taking care of him. Unfortunately, this violence has had a profoundly negative impact, of my opinion, of healthcare as a profession, and it has drastically impacted my ability to empathize with my patients. Tragically, I can't help but discourage my 5-year-old son when he tells everyone that he wants to be a doctor like Daddy when he grows up. That breaks my heart, and it makes me angry. I decided to be a doctor when I was only 5 years old myself. This job was supposed to be better than this. I wasn't warned about this in medical school. I am certainly not alone. Among doctors, 50% of emergency physicians report being physically assaulted by a patient, yet only 3% ended up pressing charges. We all know the barriers that are involved with that. All of this that we talked about today has been made far worse by the COVID-19 pandemic. It's caused our healthcare delivery capabilities and our society in general to nearly fall apart. The pandemic and its sequelae caused not only the well-publicized loss of over 100,000 nurses from our workforce, but also 130,000 physicians. A survey recently showed that 1 in 5 physicians in the United States plans to leave their practice in the next 2 years, if able. Our system is truly on the brink. The time to stand up and demand change is now. We need to take action to address the problem of workplace violence in emergency medicine and in the entire house of medicine. We need to create a culture of safety in our hospitals so that these places, once regarded as safe havens and houses of healing for our patients, can perhaps begin to heal themselves. When caregivers go to work, they should be able to focus on the task of caring for the sick and injured, not worry about they themselves becoming injured. Physicians and nurses must be provided with the leadership support and resources needed to be kept safe at work. Each hospital must be required to implement workplace violence protection programs to keep us safe from harm. And when attacks do occur, and they will, administrators and executives should treat nurses and doctors as their most prized assets and support them fully as they navigate the complicated legal and medical fallout. And the fear of retaliation from our supervisors must end. Hospitals must also provide adequate, capable, and well-trained security officers where needed, not only to physically protect us, but also to help ensure that victims are taken seriously by police when attempting to file criminal charges. Also, emergency department boarding needs to be addressed as a contributing cause. Hospitals need to invest to increase capacity and capabilities in our emergency departments as our population continues to grow, while access to non-emergency care continues to shrink. Otherwise, we truly risk disaster. But let's be realistic. Healthcare companies and hospitals will not do enough unless they are forced to. Otherwise, they would have done it by now. That is why the Joint Commission created new requirements addressing workplace violence in 2022. However, it's important to question whether these requirements are being followed and whether there's any real recourse if they're not. That is why federal legislation is before our elected officials. Some states, like California, have been successful in their endeavors and have enacted statewide laws requiring workplace violence programs. However, we cannot wait another 20 years for each individual state to pass disparate laws complicated by politics, while nurses and doctors are being assaulted and patient care is being affected by a contracting and burned out workforce. That is why we are here this week, to encourage our congressional representatives to pass legislation that is currently before them. Specifically, we urge them to pass the Workplace Violence Prevention for Healthcare and Social Services Workers Act, which will empower OSHA to require employers to develop and implement comprehensive workplace violence protection programs that are worker-driven. It's crucial that perpetrators of violence be held accountable for their actions. For that reason, Congress should also pass the Bipartisan Safety from Violence for Healthcare Employees Act, which would make assaulting or intimidating a healthcare worker on the job a federal offense, like flight attendants, postal workers, and IRS agents. We healthcare workers fought on the front lines of the COVID-19 pandemic for years. We risked our lives to save others. We slept in our basements. We isolated from our children. We lived in constant fear that we would bring home this illness to our families while others were safe locked down at home. We answered the call. Now it's time for Congress to show that we are valued. Make us a protected class of employees and make our workplaces safer for us and our patients. Passing these bills will provide much-needed resources to help prevent, mitigate, and respond to workplace violence in healthcare settings. They will also send a clear message that violence against healthcare workers will not be tolerated. Lawmakers who support these bills can show that they understand the serious healthcare workforce crisis that is happening right here in America, and that action must be taken now to reduce the burnout we are all experiencing in order to slow the ongoing exodus from nursing and the practice of medicine. I urge the media, share our stories. I urge you, contact your elected officials and tell them to support these important bills. Now, perhaps more than ever in American history, we must demand courageous leadership from our elected officials. Our patients deserve the best care that we can provide. Please give us the protections and the tools we need to be able to do so. Thank you.
Good morning. I'm Richard Moreau, Chief Government Relations Officer for ENA. It is really a pleasure to follow these emergency nurses and emergency physicians, all of whom tell compelling stories as to why we need to improve the safety and the working environment in emergency departments. The status quo in terms of violence directed at healthcare workers and the overcrowding and boarding, which is now prevalent in EDs, is simply not sustainable. It is leading to depression, anxiety, and other mental health issues for frontline healthcare workers. It is also resulting in far too many emergency nurses and emergency physicians leaving the profession or deciding not to work in the ED in the first place. But most importantly, violence, boarding, and overcrowding are also detrimental to patients. For these reasons, we have collectively come together on Capitol Hill to advocate on behalf of two critical bills: the Workplace Violence Prevention for Healthcare and Social Service Workers Act, and the Improving Healthcare Access from the Emergency Department Act. The first bill, the workplace violence legislation, will require healthcare facilities to develop violence prevention plans while at the same time protecting healthcare workers who speak out against unsafe working conditions. This legislation is urgently needed. We know from research that hospital workers suffer from serious injuries as a result of violence at 6 times the rate of all other private sector workers. This cannot be allowed to stand, and the passage of this bill, which was introduced just 2 weeks ago in the House and Senate, is critical to preventing violent attacks on workers and patients. The second bill we are supporting, the Improving Mental Health Access from the Emergency Department Act, provides EDs with the resources to connect behavioral health patients with appropriate resources in the community, whether they be inpatient beds or outpatient treatment options. The lack of access to mental health care leads to the boarding of patients in EDs, and we know that this is the average stay in an emergency department for mental health patients is 18 hours versus 4 hours for all other types of patients. Boarding is more than an inconvenience for individuals. Although healthcare professionals do the best they can under the circumstances, we all recognize that the ED is not the ideal environment to treat patients experiencing severe mental health episodes. Patients deserve better. It is beyond time that patients experiencing a mental health crisis get immediate, high-quality care in the community instead of being boarded for days and sometimes even weeks in emergency departments. Taken together, these two pieces of legislation are critical to creating a healthy and safe work environment in emergency departments. They are common sense bills, and they had strong bipartisan support when they both passed in the House of Representatives in 2021 on a overwhelming vote. We are urging our elected leaders to co-sponsor these bills and support the passage in the House and in the Senate. I also want to thank the sponsors of these bills, Senator Tammy Baldwin and Representative Joe Courtney, who introduced the workplace violence legislation, and Shelley Moore Capito and Representative Raul Ruiz for their leadership on improving mental health access from the Emergency Department Act. And with that, I'd like to turn it over to ENA's 2022 President, Jennifer Smits, for some closing remarks. Jen?
Thank you to all of our speakers today. The stories and the experiences that you heard share and demonstrate the need for action and advocacy here in Washington. You are experts in emergency nursing and emergency medicine and truly understand what people are seeing up close and personal within this profession. Your voice matters. Your stories help us make necessary changes. I've been an emergency nurse for 21 years. The increase in violence is staggering, and the work environment has changed dramatically. Nurses, doctors, techs, everyone deserves a healthy work environment where they feel safe at work and where violence towards them and their colleagues is not tolerated. Bringing awareness and action to mitigate workplace violence needs to happen now to change the way that emergency nurses and emergency physicians experience their day-to-day work. Without that action, we will continue to see nurses leaving the profession and the emergency department feeling burned out, and many feeling like they are going to be injured while also trying to care for others. The stories you heard today are real and occur every day across our country. The mental health crisis is also a very real experience, with patients waiting days, weeks, and in some cases months to get the correct level of care and the resources that they need. It is crucial to take actions to improve the access and support this patient population. Emergency departments are intended for episodic care and are not designed for these extended timeframes. The boarding and overcrowding creates long waits for others that need to be seen and increases the risk for patient safety events. Emergency nurses and all members of the emergency care team are seeing the realities of violence and the mental health crisis every day at work. The people you saw and heard from today, and thousands more across this country, need your support on these issues so that they can continue their commitment to providing the best possible patient care. Thank you all for attending today. We appreciate it.